Afifa. Welcome to In the Know. On this week's show, we're talking about the impact of back pain, and we welcome Dr. Connie DAstolfo here. She's a chiropractor, researcher, and director with Spine Group in Vaughan. Welcome to In the Know, Dr. DAstolfo.
Thank you, Julia.
So, back pain. It's a prevalent issue, but not necessarily a big issue, in a large scale, because so many people experience back pain.
Correct. Very prevalent. 64% of the population suffers from back pain at any one time. Adults, 4 out of 5 adults, for example, will experience back pain at least once in their lifetime. So very, very prevalent. And in terms of seriousness, it actually varies between being very minor, so it can be self-limiting, all the way to actually being quite serious and should be a medical emergency in some cases.
Okay, so are you noticing a change in back pain, or children coming in with back pain?
Not so much a change in back pain, but I think more of the recognition of the causes of back pain. There are over 150 different causes of back pain, probably even more than 150 causes, so it could be anything from a sprain strain. A sports injury can cause those kind of things, or just postural issues can cause back pain, to bone infections, bone tumors can also cause back pain. So it's very important that if you do have back pain, to seek medical attention, and that could be your chiropractor, that could be your medical doctor, as long as you get diagnosed and seek the right treatment for your back pain.
So there are ways to treat back pain, and we'll talk about that throughout the course of the show.
Correct.
But understanding back pain, which is our topic today, and how do you understand is it sharp pain, is it soreness, is it achiness? How do you know you might have a problem?
Well, just for example, let's say if you have a sprain strain, which is the most common cause of back pain, what you may experience is burning pain in the muscles. You may experience some achiness in the low back. Those are your general cause. That's the most minor cause of back pain. So generally speaking, if it doesn't last more than 2-3 days, generally self-limiting, you don't need to seek any care for that. And then we have other very common causes of back pain, and I see that predominantly in my clinic, and that could be a condition called sacroiliac joint pain. And this can typically presents as pain down your leg. So you may get some back pain, but you also get pain down the leg, maybe going down to the knee, and that's a very, very common cause of back pain.
Okay, and so you brought a little model of the spine here.
Show you on the model.
And so the spine is so important because it connects our entire body, basically.
There are hundreds of structures in the lumbar spine. We'll talk about the lumbar spine just for a moment. And so there are over 150 structures in the lumbar spine. And that includes nerves, it includes discs, it includes the joints themselves. I'll just briefly talk about the low back and how maybe this is
so when you say lumbar, you mean low back?
Lumbar spine is the low back. So there's 3 different segments in the spine. You have your cervical spine, you have your thoracic spine, your lumbar spine, and then you have your pelvis.
Okay.
So when we speak about a condition, sprain strain, we're mainly talking about muscles and ligaments being sprained or strained. So people may often have, let's say, an ankle injury, and they'll experience a sprain or spraining of their ankle. You can also strain your lumbar spine. So that's the most common. Second most common cause of back pain is either facet joint sprain strains, or sprain strains that actually occur in the SI joints, which are right here. And when you have an issue with the SI joint, one of the most common causes of back pain, you have extreme pain down the leg. So it can be extremely painful and debilitating. Pain generally will go down to the knee, not past the knee. And generally patients will present and say that the pain is located. They'll often say the hip. It's not the hip, it's the SI joint, but they'll be pointing to the area of the hip or towards the buttock area. So a very, very common cause of back pain. And this corrects quite well with even just spinal manipulation.
Okay, so I want to remind everyone at home that we're here for the entire hour. So if you have any questions for Dr. DAstolfo, please do give us a call, and she'll be here to answer your question for the entire hour. We actually also have a physiotherapist and a psychotherapist coming on the show later on to talk about the physiology and the psychotherapy of back pain.
Correct.
So we'll address that. So when people say, I threw out my back, people say that all the time. What does that mean?
Commonly, they're speaking about, it could be a sprain strain of the back, but very commonly it's what we call a facet syndrome. So looking back at the model again, you have these joints right here that attach,
Okay, so I'm going to turn it this way here, yeah. So these ones here?
right? So those joints, there's 4 in each vertebrae, and they articulate to one another. And oftentimes, the patient will actually get some compression within the capsule or the ligaments around that this joint, and this will cause sort of a twinging pain in the back. And that's a sensation that they feel, and they often report it as feeling like they've thrown off their back.
Okay. Okay, and it could be something, just as you said, you know, a simple twist or a bend.
That can feel like it throws it off. But oftentimes, the reason why that occurs is because of deconditioning in the spine. So, you know, if you learn to keep your spine strong, you're conditioned correctly, you have your good core conditioning, you ensure that there's enough mobility in the spine, then you can prevent this problem from reoccurring.
Okay.
It does tend to recur.
Right, and we're going to be talking with Michelle and Robin later on. How do you condition your spine?
Correct. So she'll talk a bit more about spinal exercises and stretches.
Okay, now I'm
And
sure
ways to-
I'm sure I know the answer to this, but instead of, you want to prevent back pain, right? Not treat it. I mean, you do want to treat it once you have back pain, but are there ways to prevent your back pain?
There certainly are. So the most important thing is keeping it proper movement. So ensuring that you have proper movement in the joints is one thing. Second thing, again, is the conditioning. So keeping it strong. Posture, very, very important. So ensuring that you have the correct posture when you're sitting, when you're standing, when you're walking, when you're playing sports. And protective mechanisms like back supports, if you do require it, depending on types of jobs, occupations that you have.
I was going to say, people that are sitting in front of a computer for 8-10 hours a day.
Exactly, and then that type of occupation tends to have the most frequent cause of back pain. Neck pain as well, neck pain and low back pain. Very, very, very frequent in people who tend to sit for long hours at a time. So bus drivers, cab drivers, truck drivers, and just your general office worker.
Okay, in terms of sports injuries, do you treat sports injuries as well?
Yes.
Okay. We're going to talk throughout the course of the show about how to treat, how to condition, as well as a program that you have at Spine Group. We're going to do that later on in the show, and you brought some goodies. We're going to talk all about that.
Sure.
If you have any questions about your spine, about back pain that you might be experiencing, you, yourself, family members, give us a call. We're here for the entire hour, and we're going to take a short break right now. Don't go anywhere. We'll be right back with more Dr. Connie DAstolfo, Understanding Back Pain, here on In the Know. Welcome back to In the Know. I'm Julia Supa. Today our topic is understanding back pain, and our special guest is Dr. Connie DAstolfo. She's a chiropractor and researcher. So we talked about the prevalence of back pain, and we talked about when people throw out their back. What about discs? What are discs?
Well, discs
in the back.
Discs are actually they're meant to provide to eliminate compressive forces on the spine. So this is a disc, as an example.
I'll turn it this way. Tell me where you want me to stick this, guys. Here we go. That's a disc.
And this can what can actually happen with a disc, you can get three are main. You can get a fragmented disc. That can happen if there's any compressive forces on the spine, causing an injury, and the disc will actually burst. Very serious condition.
Shattered disc?
Shatter.
Okay.
Second thing, much more common, is a disc herniation, which many people have heard about or perhaps experienced, or have family members who have a disc herniation. A third thing is what we call disc bulge. So let me briefly talk about the difference between a disc bulge and a disc herniation. A disc bulge occurs when the disc actually starts to either move laterally or move towards the back of the spine.
Okay.
So two things can happen in this case. It can actually cause compressive forces on the nerve root.
Okay.
And this will cause what most people would refer to as sciatica.
Okay.
So when somebody says, oh, I've had sciatica, often it's not really what they had, but this is what can occur if you have a disc bulge that is compressing or irritating a nerve root.
Okay.
Second thing, you can actually bulge into the spinal cord itself, causing much more serious neurological deficits.
And you mentioned sciatica, so what is sciatica?
So sciatica is basically irritation of a nerve root. So it could be this one here, it could be the L1-2, or more commonly L4-5 or L5-S1.
Okay.
So the number just indicates where it comes out of from the vertebral spine. And when there is any kind of compression or irritation of a nerve root, that'll cause pain down the leg, typically past the knee, could be all the way down to the ankle or foot. It'll cause other symptoms like what we call paresthesia, which just means numbness and tingling into the foot. So they may also get weakness. So very, very common symptomology. So the patient may not even experience pain in the low back itself.
Right.
It may all be into the leg.
Right.
So that's very, very common. And but the good news is that there actually is a treatment for this.
And what's the treatment?
The treatment generally, what we have at our clinic, at SPINEgroup, we offer what we call a spine care program. So it's a very comprehensive approach to treating conditions typically addressed to the more complex case. So they can be disc herniations, it could be spinal stenosis. Spinal stenosis is very similar, except that what I mentioned earlier, if the disc herniates, like tears right through or bulges, it'll actually compress the spinal cord.
Okay.
So the patient may exhibit more signs of weakness and pain in the legs, very, very common. So what we use for the spine care program, we use a multiple approach. It's all program-based, and we integrate our other clinical providers into this program. So this may include our chiropractor, physiotherapy for exercises and strengthening, chiropractic for spinal manipulation, one approach, spinal decompression therapy, which will actually distract the joint and cause and remove the compression or irritation off the nerve root.
Okay.
And also allow the disc to have an opportunity to heal, because this is what's going on. The disc is actually injured or torn.
So it's basically a one-stop shop. You kind of can visit all your different...
It's not so much a one-stop shop. It's more of a dedicated program approach to treating the spine. So it's a case-managed approach, for example. So for example, patient walks in, they may have had back pain long-standing, and that can also cause them to have psychological distress, depression, and anxiety.
Right.
In those kind of cases, then the patient would also be seeing our psychotherapist, Robin, or our psychologist, which we also do have. In addition to the mechanical treatment, which is generally spinal manipulation, exercise therapy, spinal decompression, laser therapy. So that's our approach. The second thing is obviously our dietary approach.
Okay, and you brought a whole bunch of, what do you call these? Joint and ligament restore supplements.
We have a variety of different formulas, which I formulated.
Okay.
And some of them specifically for back issues, we use our osteo support formula, which is a very absorbable calcium supplement. And second to that is our joint and ligament support formula. And this is mainly an anti-inflammatory. So they're all natural, natural anti-inflammatory formula.
Okay.
So it'll have things like MSM and glucosamine sulfate and hyaluronic acid. So these things and nutrients also help to address the injury in the spine.
Right.
So we're attacking the problem from multiple approaches.
Right.
And that's the key to the success of the program that we offer. Spine Group.
Okay. And what are these?
These are orthotics. So we also, in many cases, let's say for the example of the back pain patient, they may have an issue with pronation. Pronation just means that the foot is actually moving inward. So they've lost their arch. And what we do is custom fit orthotics for patients. And we'll cast them with plaster casting, and that could be done either by myself or from a podiatrist, who we also have in the clinic. And that could be also implemented within their spine care program.
Okay. So is there a trend, and I don't mean that in a negative way, but I've noticed a lot of people are wearing orthotics, more so than even 5 years ago. Is that true?
It could be maybe due to more of an awareness on the benefits of wearing orthotics. So I think that's probably why there's a trend. Patients are becoming, and generally speaking, patients are much more interested in their health, proactive, and they have access to the internet,
Right.
which we all do, and they become more knowledgeable, which they should. So I always tell patients you should always be knowledgeable in your health. I mean, you own your health, right? And you're your best advocate.
Right. And in terms of foot care, because as important as your back and your spine is, your feet are also very important, especially if you're on them all day long.
Correct.
So I've seen children with orthotics, as I'm sure you have.
That's right.
Is there a certain age that someone should be starting to wear orthotics?
I don't think it's an age, it's more condition specific. So let's say if your child is in sports and he or she's already having issues with pronation, then that could be a good approach for them.
Okay.
Or just maybe even also in terms of preventing injury. So if they're also in sports,
Right.
they may prevent rocking back of the ankles, so there's less ankle injuries, sprain strains, knee injuries. So it could even be seen as a preventative approach.
Right. Okay, excellent. And this was our last, so you talked about this, and let me show you there. What is that?
So this is actually a specimen of the human spine.
Okay.
So you're holding someone's spine.
All right.
Yeah.
Never know what you'll do here on In the Know.
And so this is basically just one of these. So
Okay.
actually you have it backwards.
Okay,
Upside
there
down,
we go.
sorry. That's the right way. And it's of the lumbar spine. So here is where the disc would sit, right here and underneath here. And then you'd have another vertebrae articulating with that spine.
And how does the spine change when you're kind of moving up towards the neck? Or does it change?
It does change. It gets smaller, much thinner, much smaller, much less bulkier, and a little longer on what we call here, which is the SP, spinous process. So you find it a little longer, but overall smaller.
Yeah. Do more people come with lumbar back pain or upper neck, or is it kind of...
I think it's about 50-50.
All right.
Very, very common. And in women, probably much more common neck pain than low back pain.
Okay, we're going to talk about how to treat your back pain, understanding it, and the psychology of back pain when we come back here on In the Know.